1 year into the pandemic, we have learned a lot about the virus that causes COVID-19. Yet, doctors and scientists continue to search for that breakthrough therapy. But fewer people now are dying from the disease, thanks to science that now makes the disease more manageable with a handful of fairly effective drugs and other interventions. Let's not forget our medical health personnel, who now have a much better handle on how to help and treat patients. Today, we'll revisit where the race stands today. I'm Dr. Freddy Gomez. You're watching MedTalk Health Talk, your partner in healthcare. Virgin coconut oil, or VCO, has been found to alleviate symptoms of mild and suspected COVID-19 cases. Joining us in today's discussion is Dr. Vermen Verallo Rowell, a dermatologist and professor of UP National Institute of Health and researcher on virgin coconut oil. Thank you very much for making the time and joining us today, Dr. Verallo Rowell. Now, most people who get COVID-19 will experience mild to moderate symptoms, and for the most part, they will be able to recover at home by getting enough rest, staying well hydrated, and taking medications to relieve symptoms like fever and maybe body aches. Dr. Verallo Rowell, where does VCO fit in this regimen of medication?
It is antimicrobial, not just to bacteria and fungus, but it is also antiviral, and this has been shown against the SARS-CoV-1, the previous one that caused the pneumonia, as well as an Argentinian hemorrhagic fever, and both of them are RNA viruses.
A study by the Department of Science and Technology has found that virgin coconut oil helps reduce symptoms of suspected COVID-19 patients. Doctor, can you please tell us more about these findings?
We are already halfway through, and already we are seeing patients who the time for symptoms to go away. In the patients who use the VCO, the way we are teaching them to put on the nose, inhale, put in the mouth, gargle, and put on the skin, in 5 to 7 days, their symptoms go away. But those that are just using the standard things of taking vitamin C and zinc, I think, it takes them about 7 to 10 days for the symptoms to go away, and a number of them have extension of the symptoms up to 14 days. We even had a patient who had moderate COVID, who, in the ones that were given just the regular one, went on to become severe, whereas the moderate cases that we have symptoms that disappear, plus the culture, which was strong, too numerous to count for bacteria called Staphylococcus. After 2 weeks, there was no more to be found, and the inflammatory marker was also very low already.
Looking forward to those hopefully promising results. Now, doctor, how is VCO taken in order to maximize the benefits it may give?
In our study at Quirino Memorial, we had them use a half a teaspoon, put it into the mouth, floss it around, glosses around, and then gargle, and whatever is left, swallow it. This is as prevention, but if they really have COVID, PCR positive, we tell them to take 1 tablespoon 3 times a day to kill the virus. In the nose, we tell them to get half a teaspoon and put a pledget or their own finger and insert into their nose.
The average consumer can afford it, and it's easier to access since a prescription is not required. What are other advantages of using it, and how is this best used, aside from someone with COVID-19?
When I started to see all of these papers, I talked with the infectious disease doctor head of Makati Medical, because I'm with them, and she's the infectious disease head. And I gave her bottles of coconut oil, and I said, this is what you do. You apply, because there are 2 ways severe COVID can be helped by coconut oil. Number 1 is that the organisms, like we talked about just now, are killed by the coconut oil. But as important is that if you are hospitalized, they have NGTs for you to feed. They get this cannula to feed you with oxygen. They open your mouth every now and then and do some things there. They get blood from you almost every day or twice a day. They have these strong lights from above, and they have chemicals that are supposed to disinfect. All of those, including the mask, all of those irritate the skin, what we call the skin barrier, and allow not just COVID to spread more readily to the skin and the mucosa, but also other viruses, bacteria, and fungus. And they can very much contribute to the pneumonia and all the other secondary infections. So now you are dealing not just with the COVID virus, for which we now have some antiviral, but you're also dealing with secondary infections.
We're very glad that you're here with us today, and this was a very interesting conversation. Thank you very much, Dr. Vermen Verallia-Rowell, for joining us today. We'll talk about current therapeutic treatment options for COVID-19. You're watching MedTalk Health Talk on CNN Philippines. Stay with us. There's no cure yet for COVID-19. However, a number of available treatments have emerged to have some promise in dealing with COVID-19. Let's welcome our guest today. Joining us is Dr. Maria Adelina Sadili, a pulmonologist from the Makati Medical Center. And we also have Dr. Carmenchu Echeverri Villavicencio. She's an infectious disease specialist from St. Luke's Medical Center. Thank you both for joining us. Now, in March of 2020, the Philippines joined the clinical trial to test the safety and effectiveness of possible therapies in treating COVID-19. Dr. Mensch, could you explain to us what some of these treatments are and what was the general purpose of this study?
One is the standard of care for COVID is actually supportive measures. However, there are new treatments that we can use for hospitalized patients, so mainly remdesivir. Remdesivir is actually an antiviral. What it does is it targets the enzymes that replicates or is part of the replication process of the virus, which is the RNA-dependent polymerase. And what the remdesivir does is it shuts down this enzyme, and therefore the virus cannot replicate anymore, and you have a decreased number of virus in the body.
Now, Dr. Mensch, is remdesivir now one of the standard treatments for patients who go into critical or severe symptoms of COVID-19?
Yes, for patients that are hospitalized, that have pneumonia, and also for those that have oxygen requirement, and patients who have comorbidities that put them at risk for severe COVID, they are started on remdesivir.
Leronlimab is currently undergoing clinical trials for the treatment of cancer and HIV. Now it's also being investigated for treating COVID-19. Dr. Mensch, how promising is leronlimab?
Right now, it's not part of the standard care of treatment.
Now, plasma therapy uses blood from other people who have recovered from an illness to help others recover. Doctors are studying its potential to become an adjunctive therapy for COVID-19. What do we know currently about plasma therapy and how effective this is in treating COVID-19?
Okay. Last year, in 2020, we have used a lot of convalescent plasma, especially for those patients with severe COVID. In the premise that if we get plasma from patients who had severe COVID, they will be able to provide the antibodies to these patients who are in need of it. However, if we look now at the Philippine Living Guidelines for COVID-19, which has just been released, it says there that the society, this is released, and this was formulated by the Philippine Society of Infectious Diseases in cooperation with the other societies, including our own Philippine College of Chest Physicians and other organizations. And it has a list of all the medicines, strategies that have been used and are still being used for the treatment of COVID. And if you look at the part of convalescent plasma there, it is now not recommended to be used for routinely for COVID patients.
Okay, so that is clear now. Now, people with moderate to severe asthma are more likely to be hospitalized from COVID-19. Dr. Madel, what advice can you give to those who have asthma?
Okay, this is a very interesting question. Uh, if everyone will observe, a lot of asthmatic patients has not had much exacerbations or attacks of asthma during the COVID pandemic because of so many different factors. No, the air became cleaner. A lot of people are just working at home, so they're not exposed to the outside environment. And my advice are as follows. Number one, asthmatic patients should continue their maintenance treatment, which is usually an inhaler containing inhaled corticosteroids. No, they should not stop using their maintenance treatment because it has been observed, and there's a systematic analysis that asthmatic patients, when they get infected by COVID, and when these asthmatic patients who are on continuous inhalation with inhaled corticosteroids, no, do not tend to have severe COVID because of that protective, no, inflammatory effect of the inhaled steroids that they're taking. So do not stop your inhalers. Number two, try not to use nebulizers if you have COVID because it will aerosolize the virus and it can spread to the other people in the house. No? And number three, please get your COVID-19 vaccines or vaccination and your yearly or annual flu vaccination because one of the most common causes of an acute exacerbation of asthma is a viral infection.
Now, for those parents with children who have asthma or even those asthmatics themselves, what kind of supplies should they have on hand just in case they have an attack?
Oh, they should have their inhaler. No, their inhaler can come as like this in a form of an inhaler or a powdered inhaler like this. Now, when they need when they cannot use their inhaler properly or they cannot coordinate, we advise them to get a spacer that looks like this. Can you see it?
Yes.
This is what we call a spacer or aero chamber. You connect the inhaler here at the bottom, and this will avoid aerosolization of the medicine.
Certain drugs have become controversial for treating COVID-19. We'll talk about this and more when we come back. You're watching Med Talk Health Talk on CNN Philippines. A common parasitic drug called ivermectin is being pushed by some sectors as a cure for COVID-19 despite health authorities warning against its use. I'm Dr. Freddy Gomez and you're watching Med Talk Health Talk on CNN Philippines. There is no current evidence that ivermectin can be used to treat COVID-19. Dr. Mensch, what exactly is ivermectin for those who are still not familiar with this?
Ivermectin is what you said, an antiparasitic drug. And there have been some exploratory studies linking ivermectin to a possible treatment for COVID-19. However, none of the studies prove that there is actually significant benefit in using ivermectin.
Dr. Mensch, why are health authorities warning us against its use, the use of ivermectin? Meron bang mga side effects ang paggamit nito indiscriminately?
They use actually 100 times the dose that is permitted for humans. No? So in that sense, we cannot just use the ordinary dose that is prescribed for humans for ordinary purposes, more so for the COVID. And usual side effects for the usual dose that we see for ivermectin could be skin rash, nausea, vomiting, diarrhea, stomach pain, facial or limb swelling. Also, you can have also neurologic symptoms, or it can affect the brain, sudden drop of blood pressure, severe and skin rash, and injury to our liver. So we have to be more cautious in using this drug, especially that there's no clear-cut benefit to using ivermectin against COVID-19.
Dr. Madel, I'd like to know your take or your opinion on ivermectin. A lot of people taking ivermectin as a prophylaxis or taking this in order to prevent a certain disease from happening.
People are taking it like once every 2 weeks or once every 3 weeks. And we have to learn the pharmacokinetic, pharmacodynamic properties of the drug, meaning how long does it stay in your blood, what dosage is correct for it to be effective. Because in vitro studies, meaning in the laboratory, they say it has been shown to stop the virus from replicating. So will that translate to clinical efficacy? No. So, but we need to know how many milligrams will it take for that to do it, and does it have a very good therapeutic ratio?
The FDA, shifting to another topic, the FDA has approved the use of Linghuasuen, but it isn't for treating COVID-19. Dr. Mensch, what does this drug do, or what is this drug supposed to do?
It's a Chinese herbal medication. There's no, like what you said, it's not really proven to have really benefits or could be or used as a treatment for COVID. But because it has pseudoephedrine, then we should caution our patients that it might have some side effects.
Now, one way to protect ourselves from COVID-19 is by keeping our immune system healthy. And to do this, we should be eating a healthy as well as a balanced diet. Dr. Madel, how does a healthy, balanced diet look like?
During this time of pandemic, I try to tell my family, my friends, and even my patients to eat food rich in antioxidants.
Dr. Mensch, how important is nutrition in trying to fight off infection?
Nutrition can actually play a role in boosting one's immune system. And because COVID-19 is a viral infection, then a big part in controlling the virus or curbing its effect to the body is by fighting it off with our own immune system.
Very good. Now, exercise should also be part of your daily routine. Dr. Madel, how often should we exercise to keep not just our bodies in shape, but I'd like to focus on exercising our lungs. If you could share any tips or exercises that could strengthen our lungs.
Okay, this has been part of my routine, especially for my patients who have been discharged from the hospital because of severe or critical COVID, because their lungs need pulmonary rehabilitation. So for the lungs, I always tell them to take 10 deep breaths every hour, while they're awake. So you take a deep breath, you hold it for 10 seconds or for as long as you can, and then breathe out slowly, like for 8 seconds.
Thank you very much. And we hope today's conversation answered your questions about where we're at with treatments for COVID-19. Thank you to our experts, pulmonologist Dr. Maria Adelina Sadili and infectious disease specialist Dr. Carmencio Echeverri Villavicencio for joining us today. COVID-19 continues to be a real and present threat. The good news is, in addition to a year's worth of research on how to reduce its spread, doctors now know what doesn't work. And of course, we finally have the vaccines with us, our most important weapon in our COVID armory. In the meantime, as we wait for a medical breakthrough on treating COVID-19, it's best to rely on available and reliable tools we can use to protect us and our loved ones. That means hand washing, wearing masks, social distancing, avoiding crowds, and other safety protocols. I'm Dr. Freddy Gomez, and your health is our mission. This is MedTalk Health Talk on CNN Philippines.